I'm Jessica Tuchek, and I'm doing an interview of a parent for a special needs child.
I'm Jennifer Schuster, and my kid is the one we're talking about.
Can you tell me a little bit about your child and some of his personality, interest, and strengths?
Oscar is now 8 years old, and he's one of the sweetest, most loving children that I've ever met. He is incredibly smart, although whenever he first came to us at the age of 5, we really had no idea what his abilities actually were, just because he had so many other needs that needed to be addressed first. He's always had very strong interests. He knows exactly what he wants, when he wants it. When he first came into my home, he was completely fascinated with dinosaurs. His favorite movie was The Good Dinosaur, and dinosaurs were his entire world. That interest has evolved over the years, and now he also loves dragons and Godzilla. He completely sees the world differently than most people. He may not always understand facial expressions, emotions, or social cues, and his communication is still limited, but he is also still learning. He has a great memory. He thrives on routine, and he's made progress that I honestly could not have imagined whenever he first came to us 3 years ago. One of my favorite things about him is that he participates in school programs. When he participates in school programs, he always looks for me and my husband in the crowd. And that may seem like such a small thing to someone else, but knowing where he started and his attachment issues, it really means everything to me. He knows I'm his person, and he expects me to be there.
When did you first become aware that your child might have a disability or need additional support?
Oscar was placed in our home through foster care at the age of 5 after he experienced significant abuse, neglect, and repeated abandonment by his family members. He arrived in October, and he had scars from head to toe across his body from previous injuries. He was malnourished and underweight and essentially nonverbal. He functioned almost entirely in survival mode. He slept approximately 45 minutes a night and would only sleep on the couch. He would not sleep in a bed or tolerate being alone in a room. He climbed pantry shelves looking for food, and he would run from adults without any awareness of danger. It was kind of a game to him. He would run into streets, through businesses, out of the yard, and even away from teachers at school. He had no impulse control, and socially he was functioning at a much younger developmental level, about the age of 9 months. At first, it was really difficult to know what behaviors were related to trauma, developmental delays, autism, ADHD, or simply the fact that he had never experienced consistent safety or stability. And with there being so many overlapping symptoms, we knew we needed a comprehensive evaluation.
What was the process of getting a diagnosis like?
We regularly saw his pediatrician, Dr. Medford, who helped educate us about the possibility of autism and other developmental concerns. By December, about 2 months after Oscar came to us, about 2.5 months, I went into her office completely exhausted and in tears. I jokingly but somewhat seriously told her that one of us needed to be medicated, either him or me. I didn't care which. My entire family was overwhelmed and sleep deprived. She then prescribed us clonidine to help him sleep, which finally gave both Oscar and our family some rest, but didn't completely solve the problem. She also referred us for evaluation for autism and ADHD. The wait was really frustrating. We finally got him in to be evaluated around the end of January. My husband, the teachers, and I had to complete extremely long and repetitive assessment questionnaires. I remember trying to fill out these pages of bubble sheets while also supervising a child who was constantly moving, climbing, or trying to run away. It was very frustrating. Many questions did not even seem applicable to his situation because of the trauma, the developmental, and his chronological age. And the concerns were so intertwined, it was unreal. So in March, we finally received the diagnosis that included level 3 autism spectrum disorder, severe ADHD, anxiety, and also trauma-related disorders. The diagnosis didn't really change who Oscar was, but they gave us a roadmap, and I was so grateful. We finally had documentation that helped us understand his needs, pursue appropriate treatment, and advocate for his services.
How did receiving the diagnosis affect you emotionally?
It was a mixture of fear and relief. There was relief because we had finally had the explanations for some of what we were seeing and could begin assessing appropriate treatment. Once his pediatrician received the diagnostic information, she was better able to address his impulse control and other symptoms. Around the same period, we began to hear more recognizable speech rather than mostly unintelligible, incessant babble. We noticed echolalia, repetitive language, communication that often consisted of movie quotes. Sorry, I tripped. Over time, we learned that these movie quotes were sometimes his way of communicating something that he did not have his own words to tell us. At the same time, the diagnosis has forced me to think about what his future might look like. I realized that this was not something that was just he was able to grow out of. His needs could be lifelong, and accepting that took some time for me.
What have some of the biggest challenges your family has faced?
Honestly, every part of our lives changed. In the beginning, our entire focus was keeping Oscar safe. He had no sense of danger. There was no pain that he really felt, and he required constant supervision. Sleep deprivation was overwhelming alone. My husband and I frequently had to leave work because he was struggling at school. Later, we added weekly speech, occupational and physical therapy appointments, medical appointments, psychiatric care, school meetings, and evaluation. Every service he needed required more time away from work. Respite has been an enormous challenge. Many people love Oscar, but there are very few that are comfortable being responsible caring for him. Qualified respite providers are incredibly difficult to find. My husband and I may go years without a traditional date night or just family time. It's very isolating to receive a special needs kiddo in your home.
What has your experience been with school and special education services?
The experiences have varied tremendously depending on the educators that are involved. During Oscar's first year at school, his teacher was amazing. She worked with us to establish safety, trust, consistency, and boundaries. We communicated daily about good days, difficult days, new behaviors, and things that we were learning about him. If something worked at school, we reinforced it at home, and vice versa. At that point, academics really weren't my priority. I believe that if Oscar did not feel safe, we couldn't reasonably expect him to learn. I later started my master's degree in social work and learned more about Maslow's hierarchy of needs, which reinforced what we had already learned firsthand. Before expecting higher level learning, we had to address basic needs such as safety and security. His diagnoses helped us obtain formal education through supports through the ARD and 504 processes, which I knew very little about special education whenever we started this process. I read laws, books, and anything else I could find to try to educate myself. I eventually requested a functional behavioral assessment and behavior intervention plan because I wanted to understand why behaviors were happening at school and literally nowhere else. I was really hoping not to take off any more work for an outburst.
Have you ever had to advocate for your child when you disagreed with how professionals handled his disability?
Absolutely. One of the hardest lessons I learned is that having special education services does not automatically mean everyone working with your child understands autism or trauma. We had an educator who relied heavily on punitive responses when Oscar became dysregulated. I repeatedly communicated with school administration and special education staff because punishment did not address what was causing the behavior. One situation became particularly concerning when I learned that Oscar was sometimes called by his adopted name when he was behaving well, but his birth name whenever he was having a difficult day, with the implication that one identity was good child and the other one was bad. This was extremely upsetting for me. His birth name was connected to a period of his life involving significant trauma and instability. I pulled the principal aside and explained that using his identity or past as an emotional consequences was super inappropriate and potentially harmful. A child should not be reminded of his worst day of his life every time he struggles behaviorally. The principal took my concern seriously and addressed the situation immediately. That experience reinforced how important it is for parents to advocate even when doing so is uncomfortable.
How has raising a child with a disability affected your family?
In every way, shape, and form. This is probably the hardest part for me to talk about because although I love Oscar with my whole heart, love does not erase the difficult emotions that came with being a lifelong caregiver. My youngest child was already 14 when Oscar came into our lives. My husband and I had imagined that within another decade or so, our children would be grown. We talked about retirement, traveling, and what the next stage of our lives might look like. We all had goals. Then suddenly I had to consider the possibility that Oscar might always need significant support from me. He may never live completely independently. I may always need to help him shower, brush his teeth, prepare food, communicate his needs, manage appointments, and navigate this scary world. Accepting that was incredibly difficult. There was a point when another foster care situation created the possibility that Oscar might have to leave our home, and the thought of him going somewhere else, starting over, and losing the safety and attachment he had worked so hard to build and potentially regressing was unbearable. We finally adopted him in March of 2025. I sometimes feel guilty that the decision was emotionally complicated for me, but I think caregivers need permission to acknowledge that they can love a child completely while also grieving the life you thought you were going to have. Those feelings can exist at the same time.
Has your child ever been misunderstood or judged because of his disability?
Every day, all the time. Oscar makes movements and sounds that other people may find unusual. He may laugh at inappropriate times. His speech can be difficult for people outside of our family to understand. He does not always recognize facial expressions or social cues. This can be awkward sometimes. People sometimes see this behavior without understanding what's underneath it. Something that looks like defiance may actually be anxiety, sensory overload, difficulty communicating, trauma, or an attempt to escape a task that he does not understand. One of the biggest things that I've learned to ask is, what is this behavior communicating, rather than simply, how do we stop this behavior?
What resources or support have been most helpful?
Honestly, finding other parents and caregivers with children with disabilities changed everything. They connected me with resources I didn't know existed, including places to obtain sensory products such as compression sheets, nonprofit organizations that help families pay for respite care. They helped me advocate for ARDs and accommodations. Our pediatrician was extremely important because she listened to us and helped guide us toward appropriate evaluations and treatment. All of his therapies, including speech, occupational, and physical therapy, have helped Oscar develop skills that we once were not sure he would ever have. The school has also been an important partner when we have had educators and administration willing to communicate, listen, and work collaboratively. I can't talk. The greatest unmet need continues to be qualified respite care. Families caring for children with significant disabilities need safe, trained people who can step in so that caregivers can take a break. We need rest. We need to maintain our marriages, spend time with other children, or simply go to dinner without worrying and carrying that weight. Those providers sometimes feel like unicorns. Also, the more specialized medical providers in the Amarillo area would be amazing. Going to Fort Worth for doctor's appointments and surgeries requires more time off. Financial wise, it's hard, and displacing him from his home where he feels comfortable is all an adjustment.
What are some of Oscar's accomplishments that made you most proud?
There's a lot of things that probably seem small to other people, but they are enormous to us. Oscar graduated kindergarten and first grade. He learned to communicate. He learned to sleep in a bed. He has developed routines. He learned that food would still be there tomorrow. He learned that when I leave, I will come back. He looks for me in the crowds during school programs because he expects me to be there. He chose his own adoptive name, which surprised the heck out of us that he fully understood what we were asking him. He chose a name that became part of his new identity and his new beginning. Most importantly, he learned how to trust and love, although it's given sparingly. For a child who spent his earliest years learning that adults in the world were unsafe, these accomplishments are enormous.
What are your hopes and concerns for his future?
My biggest hope is that Oscar reaches his own highest level of independence, whatever that looks like for him. I don't want to put limitations on him based solely on a diagnosis. When he first came to us, we didn't even know how intelligent he was because of the trauma and lack of communication hid so much of his ability. He has already exceeded those expectations in many ways. He's learning to recognize emotions and understand why he feels certain ways. His communication continues to improve. He is slowly learning social cues and how to navigate relationships. At the same time, I worry what happens when my husband and I are no longer to care for him. That is a reality many parents of children with significant disabilities carry quietly. I want him to be safe, loved, understood, and surrounded by people who see Oscar not simply his diagnosis and labels.
What has this experience taught you about advocacy?
Advocacy. Yeah,
That's it.
That's some hard words in here. It's taught me that I cannot assume someone else will automatically know what is best for my child simply because they are a professional. Professionals bring education and expertise, but parents bring expertise about the child. The best outcomes happen when those two forms of knowledge work together. I've learned that special education law. I learned special education law because I had to. I learned about ARDs, 504 plans, FBAs, BIPs, BIPs, therapies, medications, sensory needs, trauma, autism, and community resources because Oscar needed me to understand them. I also learned that advocacy does not always mean fighting. Sometimes it means asking questions. Sometimes it means oversharing information. Sometimes it means saying, this isn't working, what can we do differently? And sometimes it means refusing to stay quiet when something is harming your child.
What do you wish professionals understood about families raising children with disabilities?
I really wish professionals understood how tired families can be. When you recommend another therapy, appointment, evaluation, intervention, program, It may absolutely be necessary, but that family may already be juggling 5 other appointments, jobs, schools, siblings, insurance, medications, behaviors, and their own emotional exhaustion. Families need professionals who ask, "What does your family need?" rather than telling them, "This is what you should do." I also wish more professionals understood trauma. Behavior is communication. A child cannot always explain, "I'm scared. This reminds me of something. I'm overstimulated," or "I don't understand what you're asking." Sometimes they show you instead.
If you could give advice to another parent beginning this journey, what would you tell them?
Find your people. Find other parents who understand without requiring you to explain everything. Learn everything you can, but do not expect yourself to learn it all overnight. Ask questions, read, advocate, document everything. Celebrate progress that other people might consider insignificant. Every small win matters. Address the child's need in the right order. When Oscar first came to us, academics was the least of my concerns. I needed him to understand that he was safe, that food would be available, that he could sleep without being hurt, that adults could be trusted, and that when we left, we would come back for him. Once these foundations began forming, everything else started becoming possible. I would also tell parents something I had to learn myself. You are allowed to have complicated feelings. You can love your child more than anything in the world and still be exhausted. You can be grateful for your child and still grieve the changes to the future you imagined. You can celebrate progress and still wish things were easier. Those feelings do not cancel out love.
Is there anything else you think people should understand?
I wish people could have seen Oscar when he first walked through our door at 5 years old, and then they could see him now. At first, we were simply trying to keep him alive, safe, fed, and rested. We didn't know whether he would communicate meaningfully, succeed in school, form healthy attachments, or ever fully trust us. As of today, he's graduated 2 grades. He has routines. He communicates. He loves deeply. He laughs. He learns. And he always looks for family in the crowd. His progress didn't happen because one medication, one therapist, one teacher, a parent, or a diagnosis that fixed him. It happened through years of consistency, structure, therapy, advocacy, education, patience, mistakes, and people continuing to show up. Oscar still has significant needs. Autism is part of who he is. Trauma is part of his history. Neither one tells his entire story. But he's not the same frightened 5-year-old that came into our home. He is Oscar, and watching him discover who Oscar is has probably taught me more than anything I could have ever taught him.